When we talk about healthcare issues that are being amplified due to the pandemic, one of the major areas that's suffering is access to hearing healthcare.
With over 16% of Kentuckians identifying as deaf or hard of hearing, access to proper hearing health professionals is no small issue here. Joining us today is Brett Bachman from Heuser Hearing Institute to talk about how they've been helping people enjoy all the sounds of the world since 1948. Brett, thanks for joining us.
You're welcome. It's a pleasure to be here.
You know, and I think you guys have been around since 1948. You're coming off a crazy pandemic year. It really does kind of put the spotlight on how you have to give access to health care to everyone, especially when it comes to hearing.
Yes. I mean, hearing during this period of lockdowns and telehealth and things like that. Hopefully we're not going towards another one, but we've got to take care of the virus any way we can and combat it. But hearing has become hyper important so that we can continue to communicate across our virtual medium as we're doing today. If I couldn't hear you, we wouldn't be talking right now.
Yeah, fair point. How does Kentucky compare, Brett, with the rest of the country when it comes to hearing issues and how people can get help?
If you live within the city of Louisville or some of our or Lexington, the access to care is fairly good. We do have right now. There's about 110 audiologists in the entire Commonwealth. About 88% of them live within Louisville. So if you're outside, your access to hearing healthcare is really difficult, and that's something that we're working on here at Heuser as well. And, you know, as you mentioned earlier, we've been around since 1948, working on communication, working with the deaf or hard of hearing, and we want to be able to spread that out throughout the rest of the Commonwealth as well.
And what people don't realize is how much your hearing affects the rest of your body. You know, having hearing issues can cause a lot more problems than just your ear.
Yeah, the medical science and research is starting to show and has shown that uncorrected hearing loss can help early onset dementia. It definitely relates to depression and social isolation. I mean, if you can imagine that you want to go out into the community when we are able to, and you can't understand what people are saying, you don't really want to go out. And then that just kind of builds on itself. And then what happens next thing you know is you are isolated in your place and you don't really want to leave. And one of the things that we work on here in Louisville is we have several programs that encourage people to get out and volunteer and do what they need to do and to be healthy and productive lives.
And Brett, if someone thinks that they may have a hearing issue, what can they do?
Well, there's a couple easy ways to determine that, and that's if you're just saying what a lot, and if you're avoiding areas that are loud, like restaurants and things of that nature. But what they need to do is go to the nearest health professional. If you're here in Louisville or around, we actually serve 53 counties. You would call us and say, I need to schedule a hearing test. And you can come in, you may or may not need a hearing solution or a prescription. But it's good to get that baseline to kind of determine whether or not you have hearing loss that can be corrected.
If you think you may have a hearing loss, you can start your journey toward better hearing by making a fast and free online hearing test online at thehearinginstitute.org.